In my last video, I showed how to place the band and the garrison system, and today we're going to be restoring the tooth with composite. Okay, so after I etch, prime, and bond, my next step it's going to be to put some flowable all along that margin of the prep. Okay, and I also like to use my exploder and my probe to try to get it in between the margin. And before I lacquer, I'll put my first coat of composite in there. I need to move fast because if not, it's going to lacquer quick. So that is the first coat of composite. I tried to go with my spatula all around the curve of that band to start giving the tooth some anatomy, because if not, you're gonna have to do it after with the composite burrs. Okay, and then I'll do my other coat of composite. Okay, you want to pack it really well, and you also want to do 2 millimeters of increments of composite because you don't want to have any bubbles in there. Now you can see I'm always curving my composite with my instrument. Sometimes I have to use a thinner instrument to get that in between. And I kind of like start giving the tooth some anatomy also. Okay, you don't want to add too much either because then you're gonna have to remove. Or also something you can use is the microbrush to help you really pack that composite in there. Sometimes I use a microbrush also for the interproximal box. So you may still need to add some more, but and also you can use the instrument made for the back molars and the premolars to start giving some anatomy. A few seconds only just to get it a little harder. And then you check again with your probe and your exploder just to see if you have any spaces that you have to add more composite. Obviously, it's going to be different in the mouth. I have to do this in one video because I have to restore another tooth. And then give some anatomy. Now, after you do the composite, obviously, you're going to have to also restore the occlusion, right? You have to check the bite of the patient. And it can look really beautiful here, but most of the times you're going to have to readjust that anatomy that you gave to the tooth. And then I'm so used to using my loops that it's really hard for me to see if I left any creases or anything like that on the composite. After we polish the whole restoration, we're going to have good contours and good anatomy also.